Now, after months of complaints on the stringent requirement to obtain certificate verification due to the revised guidelines by the Nursing and Midwifery Council of Nigeria, the nursing group administrators is re-emphasizing the need to dialogue with key players for a more equitable and inclusive process. Zainab Akonde has details in this report.
The issue surrounding the verification guideline came into limelight in February 2024 when nurses under the National Association of Nigerian Nurses and Midwives embarked on a protest and threatened to shut down the health sector. This protest was sparked by the Nursing and Midwifery Council of Nigeria after a circular was issued to revise the guidelines for certificate verification across the country. 3 months after this protest, the story remains the same. Disturbed by this, the nursing group administrators in Lagos State is calling for the reversal of the verification guidelines.
We demand an immediate withdrawal of the nursing verification rules by the Nursing and Midwifery Council of Nigeria, taking into account the concerns raised by nursing professionals, healthcare stakeholders, and the general public.
We are asking NAM to liaise with the Nursing and Midwifery Council of Nigeria, let them withdraw that new guideline so that the aggrieved nurses that went to court can withdraw the case.
For nurses who are interested in pursuing international certifications, they believe the implementation of the policy is an infringement on their rights and career aspirations.
I feel like it is like a bondage for nurses. It's not a free will. It's not a freedom for everybody. Why will I graduate as a nursing student and I won't be able to participate in other activities? Like, what if I want to become a travel nurse?
Lately, I've been very discouraged to practice in Nigeria, and seeing this guideline is more discouraging. I feel it's going to really frustrate young nurses, student nurses that wants to, travel out or practice outside the country.
The nurses also want the council to address the welfare of nurses in the country. This, they say, will improve healthcare delivery and address the brain drain in the sector.
Competitive remuneration and compensation packages for nurses, which should include upward review of the retention allowance, upward review of hazard allowance, and the payment of a hardship allowance that accounts for the increased caseload.
As the nursing group administrators look forward to a more effective certificate verification process, they also hope for a future where nurses' welfare will be prioritized. Zainab Akonde, TVC News, Lagos.